Welcome back to the HealthTech Explorers channel. Today, we're diving into a topic that every healthcare professional should know about: how to create effective and safe prompts for AI tools like ChatGPT, Perplexity, or OpenEvidence. These systems can help doctors analyze data, prepare documentation, explain complex medical topics to patients, and much more. But here's the thing. To get accurate, reliable, and compliant results, you need to know how to communicate with AI properly. In this video, we'll share the essential rules for writing medical prompts that protect patient privacy and deliver trustworthy information every time. Why prompts matter in healthcare. AI chat tools are becoming powerful assistants in medicine, but a poorly written prompt can lead to incorrect advice or privacy risks. In healthcare, accuracy, clarity, and compliance with regulations like HIPAA and GDPR are non-negotiable. That's why structured, well-designed prompts are key to using AI safely and effectively. Main rules for creating medical prompts. 1. Define your role and AI's role clearly. Always start by giving context so the AI knows who you are and what you need. For example, you are an experienced general practitioner with 10 years of practice. I am a cardiologist. I need help preparing recommendations. 2. Use only anonymized data. When describing a patient, include only age, condition, and relevant details. Never names or identifiers. Never names or identifiers. For example, a 55-year-old patient with type 2 diabetes currently on metformin and insulin. This ensures compliance with privacy laws. 3. Be specific with your question or task. The clearer the request, the better the result. For example, explain why blood sugar control is important. Write a formal letter to a patient about the need for vaccination. 4. Request reliable sources. To make sure the AI provides accurate information, include links to recent clinical guidelines. Make sure to note that this information must be verified by a medical professional. 5. Specify style and format. For patient communication, request simple, jargon-free language. For official documents, ask for a formal tone. For example, create a simple explanation for a patient without medical terminology. Write an official insurance report in professional language. 6. Never share personal data on open platforms. Sharing patient identifiers with AI systems that don't guarantee HIPAA or GDPR compliance may lead to legal consequences. Always use de-identified data. Examples of medical prompts for patient communication. I'm an endocrinologist. Explain to a patient with type 2 diabetes why insulin therapy is important in simple terms. Prepare instructions on how to measure blood pressure at home correctly. Explain what hypertension is and why treatment is essential so the patient understands the risks. Create a guide on how to take antibiotics properly to minimize side effects. Examples for sensitive conversations. Help write a tactful explanation to a patient about how smoking affects their lung health. Suggest how to discuss alcohol cessation before surgery without sounding judgmental. Provide wording to explain a serious prognosis to a patient's family without panic or unnecessary emotions. Write a supportive message for a patient with depression who is anxious about visiting the clinic. Additional useful prompts for doctors. Summarizing clinical studies on a specific topic. Preparing template letters or notifications in multiple languages. Drafting medical documentation according to regulatory requirements. Creating educational materials tailored to different age groups or literacy levels. And final advice: the more structured and specific your prompt, the better the results. Always use anonymized or aggregated data for safety. Double-check AI-generated information before using it in practice. Treat AI as a support tool, not a replacement for clinical judgment. Stay updated on data protection laws and AI regulations. That wraps up our guide to writing effective and safe medical prompts for AI tools. By following these rules, doctors can use AI to save time, improve communication, and get reliable support, all while protecting patient privacy. If you found this video helpful, don't forget to like, subscribe, so you don't miss any future videos. See you next time!